The views and opinions presented by the host, guests, or callers on this program do not necessarily represent the positions of WMBS Radio.
The information you will hear is general information about health insurance. If you want specific health insurance advice, please call the Health Insurance Store at 724-603-3403. The host or guest may not be able to mention specific health insurance companies. You cannot change, purchase, or bind any insurance policy over the radio.
Your local station, WMBS, it's Hour 2 of the Health Insurance Store with Aaron Zolbrod. And you can give us a call at 724-438-4593 if you have a question for Aaron. And it can be on any topic related to health insurance, advantage plans, Medicare, the whole 9 yards. You can give us a call, 724-438-4593. And again, if you want to give them a call at the store, 724-603-3403, or online at getyourbestplan.com. And Aaron, we're talking about some questions that you've been asked that actually resulted in your last 3 columns in the Post-Gazette and the Tribune, or rather the Trib. Let's be local
Review,
yeah.
And also known as the Trib, yeah.
Yeah, there's only 9 names of it. Anyway, we're kind of edging into the second question here because it was somebody who discovered that they moved from an Advantage plan to a supplement and then found out they had a deductible for prescriptions that weren't on the Advantage plan and are thinking about moving back next year. The question was, can I do that? And what would your advice be? So, by the way, what is that deductible again?
The deductible is $435 for Medicare Part D. And again, Advantage plans don't have that. People who buy supplements, because supplements don't come with prescription coverage like Advantage plans, they need to purchase what's called a standalone Part D plan. And those plans not only have a premium, and the average premium for 95% of people is between $15 and $25, but there's also a $435 deductible on Tier 3, 4, and 5 drugs as well. And if not told about that, that could be a surprise. I mean, that's a big chunk of money, and that needs to be paid all at once. That's not something that gets divided over a course of 12 months. So what happens is those people who are on a brand-name medication, with the cost of brand name medications being over between $300 and $700 a month now, you could show up at and I'm sure what happened with this lady, she showed up at the pharmacy in January and went to pick up a brand name medication, and they told her it was going to be $400 and something dollars, and depending on what kind of budget she's on, that could be a shock.
Yeah, I was thinking that would be a rude shock to all of a sudden. And not only that, we're talking about $400 every time she refills the prescription.
Well, no, that's a one-time annual deductible. Yeah, so once that's met, then it goes back to reverts to what she would normally pay. And brand name medications generally have a copay between $35 and $50 a month. Mm-hmm. So those on Advantage plans would have just started in January paying let's call it $40, where she had to pay the $435 first before she starts to pay that $40 copay. And that's a big expense.
Yeah, especially if you're on a limited income or, you're on a budget, all of a sudden have a $400 hit. So why is there a deductible? Is it just part of the deal?
Well, I'm just going to speculate, but, with Advantage plans, remember we said with Advantage plans, the federal government pays the company about $800 a month to become that insurance company. So that's almost $10,000 a year. Now with Part D, the federal government also pays them some money too to become the insurance company and take on those risks. So I'm guessing because there are no prescription drug plans left with an affordable premium that don't have a deductible. So I'm guessing that they're just not being reimbursed enough where they can, afford to pay that deductible for people or not have a deductible, and that's the difference between them making a profit and not making a profit, is my guess. And so in order to make a profit, they have to have that deductible, as opposed to Advantage plans that can afford, not to have that deductible and still make a profit. That's my guess. I don't know for any certainty. But it is just the way it is now. Almost every single one of our 6,000 supplement clients who have prescription drug plans, and we may even have 7,000 people on prescription drug plans because we have a lot that's all we do for them. I'm guessing probably 90% of them have that $435 deductible.
And is this something also you have to sit down? You should sit down with somebody who is thinking about this and go over their medications, because again, when Medicare started, it was like aspirin.
Oh, absolutely. I mean, when someone wants to leave an Advantage plan, like this lady did, she left an Advantage plan to go to a supplement, and she may have read some of my columns that she thought that she was better off going that way. When somebody wants to do that, I have to warn them of that. I said, listen, before you make this decision, again, you're paying $50 for your Advantage plan. Supplement might sound great at $115. Okay, it might not sound like something you can afford because you're going to eliminate your copays, but I've got to warn you, you're taking a medication where you're going to have to spend $435 the first month that you have that. Now, if we divide that over 12 months, that's basically like adding $38, or $35 or $40 to the premium if we're figuring it like that. And again, this goes into what we're going to talk about next is what is total cost of ownership. We have to figure those things in to help you make that decision on what to do.
And again, it would be very nice if pharmacies would say, well, we'll let you spread out the payments over 12 months, but...
Yeah, they're not going to, that's not how it works. Yeah. It's just not going to be how it works. So again, you want to deal with an agency like ours who's going to make sure you know all these things. Again, if you just call somebody, they may not tell you that. We're so careful to tell you about the deductible that we actually have a disclosure that we have our clients sign when they take a supplement and take a Part D Advantage plan, that we say, listen, you realize we've explained this to you because we had to do that because we've had people we've went over that with, and it may just slip past them. And then when they got the deductible, they were very upset because they didn't remember us telling them that. So, you want to deal with somebody who's going to explain all of these things to you. Number one, so you know what's coming. Number two, so you can make your best decision. And going from all of those great things we said about a supplement doesn't necessarily mean you can afford one. Again, the best insurance in the world's not worth a penny if you can't afford to pay for it.
And it's sitting down with somebody, again, and we don't want to tar all of the salespeople and all the companies with the same brush, but... No,
absolutely not.
Yeah, but there are a lot of people out there, and they're getting paid to do this, who just want to, again, sell the gym memberships and the sell the sizzle, and are not really there to answer questions because they need to get you off the phone and get the next phone call.
They could be trained by the company that sells these things on how. I'm sure they are trained on what you want to focus on, what you don't want to focus on, what you're supposed to tell people and what you don't. I don't know how those inside salespeople get paid, if they get paid bonuses when they sell plans. If you get a salary obviously or an hourly wage, and then every time someone takes a plan and your name is attached to it, you get extra money. I'm guessing that's probably accurate for me to say they do that. I can't say for sure. They maybe get extra money if they sell the plans that are more profitable for the insurance company, and that may be a plan that costs more money. That may be a plan with higher copays. I don't know. So. Again, I know one thing, that when you call directly to a company, which I don't recommend, they're only able to sell you products from their company. They can't compare them side by side to, the 5 others that are competing with them. I know that a lot of companies won't even mention the supplement option, period. And, it's very common for somebody to turn 65, lose their insurance. They might have had it through, they're going to generally have it through one of the big players in the market, and I've heard it hundreds of times. I just called them and told them I was going on Medicare and I needed a plan. This is what they told me I should take, and so I did.
And then you go in and talk to Aaron, and you straighten things out.
Well, sometimes we can, and sometimes we can't change everything, Bill, because remember, if you start with an Advantage plan and want to go back to a supplement, you may not be able to do that. Now, we can always go from an Advantage plan to an Advantage plan, so when you say straighten things out, what I've done is I've taken people who were on an Advantage plan and were maybe didn't have the best value, and then I've moved them to one that does have the better, the better overall value. But there are people who've wanted to leave an Advantage plan because they didn't know what they were buying and they wanted a supplement, but they had some medical conditions like AFib or certain types of cancer or insulin-dependent diabetes or COPD, and they weren't able to get a supplement again. So, that's the biggest risk of taking an Advantage plan. Again, we're going to talk, in the next 20 minutes or half hour how great Advantage plans can be.
Yeah.
But that is one of the biggest risks right there of signing up for an Advantage plan, having some expensive bills, or not knowing you signed up for an Advantage plan and not being able to go back to a supplement.
And if you want to talk to Aaron right now, if you have a question about health insurance, not just what we're talking about here, but any situation, you got a question about a bill, again, you've got a question about coverage, decisions, give us a call, 724-438-4593, 724-438-4593, or at the office at the health insurance store in Connellsville, 724-603-3403, or getyourbestplan.com. And again, talking about the supplements, the Advantage plans, and the standalone Part D. By the way, is this something everybody ends up paying for at some point?
So again, the Part D is something almost everybody has to have. It's prescription coverage, and so it comes with Advantage plans, and those who take supplements have to purchase it. And as far as the deductible goes, that's something that everyone has to pay. On Advantage plans, you don't. On supplements, and you purchase a standalone Part D, almost all plans have it. Not everybody has to pay it, and here's why. With almost all standalone Part D plans, the deductible only is subject to Tier 3, 4, and 5 drugs. Tier 1 and 2 generic drugs, you don't have to pay that deductible. So most people who have these standalone Part D plans, their Tier 1 and Tier 2 drugs are only $0 to $7, and that $435 doesn't come into play. So those people who don't take brand name drugs or can avoid them won't pay the deductible. However, you could be going during the year and, you say, I'm only taking 2 drugs. I take a generic blood pressure medication and generic cholesterol. Those drugs are generally $0 or, between $0 and $2. Well, what happens during the year if you catch something, the flu or you get a rash and it takes a brand name drug? You may only take it one time, and then you go to the pharmacy and fill it. It's brand name. It might cost you up to $435. So again, you got to be prepared for that. People need to understand when they take a supplement that this could, even though I'm not taking generic, I'm not taking any Tier 3 or 4 drugs now, doesn't mean I might not have to take one down the road.
And suppose also, let's use a scenario of blood thinners. You're on warfarin, which is, that's now a generic. It's been a generic for a long time. But let's say in July, your doctor says, I really want to move you over to Eliquis. And
right.
What happens then?
Well, I'm glad you mentioned that because, Eliquis is right now, from what I've seen, the number one most prescribed brand name drug other than diabetes medications. So other than diabetes, Eliquis is, I think, the most prescribed brand name drug, and it's a blood thinner, and almost everybody who's been diagnosed with AFib, has had a heart attack, a stroke, a bypass, among other things, is going to be prescribed that because it eliminates getting that blood work done that people on warfarin get. And so it might be something that you choose due to convenience, or it might be something that your doctor wants you to take for whatever reason. And if that happens in the middle of the year, then if you haven't met that deductible yet, then you are going to meet it. You are going to have to pay that. Now, somebody who's already had a brand name medication they've been taking, they're not going to have to pay the deductible again. It's not a per drug on a per drug basis. It's on an annual basis. So once that deductible's been met, it's met for the entire year, so you wouldn't meet it again in that case. But if it was your first brand name medication you had taken for the year, then yes, indeed, you would meet that deductible.
And again, one of the issues with your medications is that pharmacies generally don't bill, and this is money you need to have right up front, too.
Yes, I mean, they're not going to bill you. They're just not. You're going to show up at the pharmacy. They're going to tell you this is X what you owe. It's expected to be paid. It's not like, in the emergency room you go in and you don't have to pay the bill until after you're out.
Yeah.
And if you don't have insurance, the law states that they have to treat you. It doesn't, I've never heard of somebody being able to run a tab at a pharmacy.
Yeah.
And that's basically what you'd be asking them to do. And so, I don't know what somebody would do who showed up and didn't have a credit card to cover that or didn't have the cash on hand to do that. I'm not sure what they would do.
Yeah, you can't go all wimpy on them and say, well, I'll gladly pay you Tuesday for some Eliquis today.
Right.
So,
I just have never heard that scenario.
Yeah. Other benefits of Advantage plans, again, that you should know actually before deciding on what you want to do.
We talked about the sizzle, which the sizzle I consider to be really, a lot of the sizzle that people talk about are, you'll see these commercials that say 000, 0 premium, 0 copays at primary doctors, and 0 copays for tier 1 generic drugs. And then there are lots of other ancillary benefits we talked about. And, there's some that have been around for a long time, like dental, vision, and some hearing aids, and especially the Silver Sneakers, which is a gym membership. But there are some newer ones as well. One of the ones that just came out last year in 2019 that was available for the first time to the general public, that were only available to people that had medical assistance before, something called over-the-counter benefits. And I'll refer those to those as OTC, again, over-the-counter. That's the acronym for it. And this is an allowance that some plans are giving you that allows you to order anything practically that you can find on the shelf of a drugstore or at one of the big retail stores that we all know exist, or dollar stores that you could go in and buy on your own. Well, you're given an allowance, a dollar amount to spend on these things, and you get a catalog, and you go through that catalog, and you either call a phone number or get online and place an order for things like vitamins and ibuprofen or acetaminophen, or things like thermometers and braces for ankles, and even mosquito repellent and sunscreen, chapstick, toothbrushes, toothpaste, mouthwash. I mean, again, you name it. If it's on the shelf in a drugstore, it's available for you to order. And so on the high end, there are plans that give you $40 per month to spend on those. And on the low end, it could be $25 a quarter, which is less than $10 a month. So it varies on how much you get. But, there's a very popular plan right now that gives $40 a month for that, and people really like it. People, you go through this catalog and say, oh, gosh, boy, I've been meaning to buy some Neosporin. It's something stuff that you don't remember to get when you get at the store because it's not stuff you use every day, and you don't remember you needed it until you cut your finger or, that you realize you didn't have any Band-Aids. But it's all that stuff that you can order, and that's kind of nice. Now, something else that's newer is comprehensive dental. Now, for years, companies have been saying dental coverage, but up until 2019, when they said dental, and companies still only provide this, they meant just a couple teeth cleanings and maybe a set of x-rays. Well, now there are a couple companies and a couple plans that are offering comprehensive dental. And when I mean comprehensive, we're talking about not just cleanings and x-rays, but fillings, extractions, crowns, root canals, dentures, periodontal, and some companies are offering as much as $2,000 in a year's time for that comprehensive dental benefit. And lastly, another new benefit that's available in quite a few plans now is if you get out of the hospital, if you've been inpatient in a hospital, or if you've stayed in a skilled nursing facility, you can get 14 prepared frozen meals mailed to your house that you can just stick in the microwave. It's 7 days worth of meals. I believe they're lunch and dinner. And somebody who's eaten them has told me they're pretty decent. So these are newer benefits. In addition to, the eyeglasses and eye exam and the gym membership, which has been around forever, which can be, for somebody who goes to the gym, that's a $30 a month benefit. The YMCA is $35 now. Snap Fitness is $30 to $35 a month now. Not everybody wants to go to the gym. That's $10 a month. And so that can be a very nice benefit. So, if you added up all the value of these benefits and if you use them, it can be a pretty big number. Now, I want to warn everybody. There's a couple little warning here. Not all plans have over-the-counter benefits. Not all plans give you very much of them. Very few plans are going to offer you a decent amount of comprehensive dental without which what I can consider $1,000 or more. So there's very few plans that do that. So don't think because a company says they have dental, vision, and over-the-counter benefits, meaning you're going to get much of it, and B, just don't assume that every plan has them, because they don't. There's still plans that don't have little or no dental benefits or over-the-counter benefits. So, you've got to keep that in mind. If that's important to you, those benefits are important to you, then you've got to make sure you're purchasing the best combination of plan that includes a good premium, good copays, and has as much of that stuff as you can get.
When you talk about comprehensive dental, are we talking about they give you $1,000 and you can use that to pay for anything, or is it where they pay for half of it and you still have to be on the hook for half of it?
Outstanding questions. Yes. So listen, here's what's crazy about Advantage plans. Bill, that can differentiate between county and county to county within the same plan. So we've got a plan, probably the most popular plan in the last 2 years. And if you're in Fayette County or a couple of the surrounding counties, it's 100% for cleanings, 50% for and 50% for fillings, crowns, root canals, etc. 50-50. So if you had a $1,000 crown, they pay $500, you pay $500. Now that's still better than not paying anything. But it's not $1,000, $2,000 or $1,000 to spend any way you like. It's generally now in Allegheny County, instead of paying 50% for the fillings, it's 80%. Now why they do that from county to county, Bill, I don't know.
Because
somewhere there's somebody that's a bean counter somewhere that's been paid to be an actuary or a math wizard or something like that to evaluate trends and reimbursement rates and this and that and the other that decided. It's just crazy.
Yes.
But, again, those are the things that you can't probably not going to differentiate on your own, that you need someone like us who know this.
Yeah, exactly. This is where and we're talking about, my experience is, an hour or so, sit down, go over things, and you can do it on Zoom, you can do it on the phone. Call Aaron at 724-603-3403 or online at getyourbestplan.com. And if you want to talk to Aaron here, you have any questions at all about health insurance, 724-438-4593. It is the Health Insurance Store with Aaron Zolbrod on your local station, WMBS. Well, so a lot of folks listening are probably thinking to themselves, this Advantage plan thing sounds like the way to go. And is that all the case, or is it something where they should sit down and talk with you?
Okay, so I want to go over a scenario, and then I want you to ask me that question again, Bill,
right.
Okay? Because I'm going to make the case for an Advantage plan, a big-time case for Advantage plans right here. So I went over, I did a scenario, and again, I went over this on my webcast. I'm going to record a webcast on, and for those of you who don't know that I am doing webcasts now, you can find those on my the Health Insurance Store website, getyourbestplan.com. We've been doing some webcasts, and I've also done some podcasts that you can. And I went over this and put this on the screen for everybody to look at. But I want to go over a scenario that kind of goes along with the next question: is what is total cost of ownership?
Right.
And again, I'm going to kind of get into that because we're going to run out of time here, I'm afraid, without getting into this question in great detail. But total cost of ownership represents the amount of money you're going to pay not only in premiums, but also what you're going to spend on out-of-pocket costs for copays, deductibles, so on and so forth. And then I also want to add back in some of the value of these ancillary benefits that we just went over: dental, vision, over-the-counter, gym memberships, et cetera. So I'm going to look at a scenario right here. So I'm going to go over, I want to talk about a 5-year or an annual and a 5-year cost, and give us the same exact scenario with the same number of doctor visits and et cetera that people had over a 5-year time. So I want to start with a supplement, which again we know, and we're going to talk about supplement plan N. And with supplement plan N, the only cost somebody's going to have medically would be basically a $200 deductible, Medicare Part B deductible, $20 at a doctor, and $50 at an emergency room. Okay? Now we're going to use again. But that's not only the only cost. That's all I pay is $200 deductible and $20 at a doctor. So I go to the doctor 5 times, I'm only paying $300. Now remember, there's also the cost of the premiums
Right.
that we have to consider. So we're going to look at the average cost of Supplement Plan N for a 65 to 75-year-old, which would be $110. Now, we're also going to look at the cost of most people pay for a prescription plan that's got to be added to that, which is $15. So the premiums for 12 months worth of Plan N supplement would be $1,320. The premium for Part D would be $180. We also have to figure in there's a $198 Part B deductible. So you have to pay that. That's your medical deductible before anything else is paid for. Anything outpatient is going to be paid. So everybody's going to definitely meet that. So that's $200 additional dollars. We already talked about a Part D as in David deductible, which could be on your prescriptions. No, not everybody's going to pay it, but let's assume somebody does. Let's assume that people are going to pay it. Add that into the equation. That's going to be another $435 annual cost. Let's use 10 doctor visits a year, which I think might be a little high, but let's use 10 doctor visits. Somebody on Plan N is going to spend $200 a year on 10 doctor visits, and let's say everybody goes to the ER once a year. That's a $50 copay. So between all of those deductibles, copays, and the premium, the total annual out-of-pocket is going to be $2,388 a year. In 5 years, Bill, that comes to $11,940 that somebody's going to pay if they have Plan N at $110, Part D at $15 a month, the deductible of $200 for Part B as in boy, $435 for D as in David. They go to the doctor 10 times a year in the emergency room once. They're going to spend about $12,000. Okay. Let's talk about an Advantage plan. We recommend plans between $0 and $60. Let's use a number in the middle. That's $30 a month. Okay? That's only $360 a year for the premium. We don't need to purchase a separate prescription drug, so here's where the premium comes in. Instead of spending $1,500 on premium, we only spent $360. We don't have to spend another $635 on an Advantage plan on deductibles because there are none. Now, let's use the same scenario. Let's say we have 10 doctor visits, 5 of them are specialists, 5 are PCP. We're going to spend $200 on specialist visits. We're going to spend $25 on primary visits. Let's say that somebody has one MRI or CAT scan a year. That's going to cost $200 with an Advantage plan. Let's say miscellaneous copays like blood work and X-rays and some other stuff are $250 per year. That means we're spending $1,235 a year. And again, Bill, this is somebody who's relatively healthy.
Right.
Let's say that also over 5 years somebody's hospitalized twice, and they have a good copay for that at, let's call it $325 per stay. There's another $750. So if we average that over a course of 5 years, that person spent $7,000 between their premiums and their copays. So instead of $12,000, they spent $5,000. So there's already a $7,000 difference, but guess what we haven't factored in yet? How much value did they get in ancillary benefits? Were they using the gym and getting a $30 a month value there? Did they get their glasses every other year? That could be up to $200. Did they have a plan with an OTC benefit or not? Did they have comprehensive dental? Let's say that they used some of that stuff, and it came to $1,000 a year in real benefit, okay? In real dollar benefit. That's $5,000 a year. If we factor that in, their net 5-year total cost of ownership, if we deducted the value they got of those services that they would have spent out of their own pocket, their net cost was just around $2,000. That's $10,000 difference, right?
Yes.
So again, ask me that question.
All right. So, somebody might think that Advantage plans are the way to go, and they also might think that supplement is the way to go. Is that the case?
So if you heard me say that scenario, right, where somebody who stayed relatively healthy over 5 years could save $10,000 if they chose plans wisely, you would think maybe that everybody might think that an Advantage plan is the best way to go for everybody. And indeed, when you hear that, it might be. But remember what we talked about. What is your aversion to risk? Because the risk of Advantage plans, the two biggest risks, in my opinion, are as follows. Number one, you could have a scenario where you have a plan that's got a $500 to $6,700 max out of pocket. So over a 5-year period, let's say that you needed chemotherapy in 2 of those years, or you stayed in a skilled nursing facility for any length of time, or you needed a high-dollar prosthetic device, or you needed infusion therapy such as Remicade, or expensive shots for macular degeneration or something else, and if you met the out-of-pocket maximum of, say, let's call it $5,000 over 2 years, well, your savings were wiped out, right? So there was no savings. The second risk is, God forbid, and I would say this only happens to 1 out of every 100 people, but they're diagnosed with something that they're going to be billed the maximum out of pocket every year for the rest of their life. I have probably met 50 or more people who in that situation, maybe more, and that's just me, where they're diagnosed with certain cancers, lymphoma, or other types of cancer, and they need to take chemotherapy every year as a preventative measure, or they get expensive shots for cancer, or again Remicade. Those people are going to meet that maximum out of pocket between $3,400 and $5,000 every year. So taking an average out of pocket cost of $5,000. So we talked about a 5-year cost of $12,000 with a supplement. Well, guess what? Those people spent $25,000. Okay, so that's risk number 2, and then there's a third risk. The third risk is you could be diagnosed with something that might not be treated at one of your network facilities. Okay, so again, our 2 best hospital systems in Western Pennsylvania that have the best reputation. Not that we don't have other good hospital systems, are UPMC and Allegheny Health Networks. There are plans where not only are those hospital systems aren't covered, but you might be able to go to the Cleveland Clinic, MD Anderson Cancer Center, the Mayo Clinic, Johns Hopkins. I've had several clients whose lives were saved at those facilities. Okay, the one that comes to mind the most is I had a client in 2017 that had that got a rare parasite from tainted romaine lettuce. She had barely turned 65. The only 2 hospitals in the country that could treat her were the Cleveland Clinic and the Mayo Clinic. She went to the Cleveland Clinic, she stayed for 115 days, and she lived to tell about it. If she would have had certain HMOs, 90% of the HMOs in 2017, 90% of them did not cover the Cleveland Clinic, and she probably would have passed away. She's 1 in 1,000. Those people who end up paying that out of pocket every year, I don't know what that is, 1 in 100. Are you willing to take that risk? That's the question you have to ask yourself. Because I just showed you how probably many people could save a lot of money on Advantage plans over time. Are you willing to take that risk of those 3 risks that I just talked about? Okay? And that's where, again, when you say, I just put forth a scenario where somebody would go to the doctor 10 times a year, including 5 specialists, get 1 MRI or CAT scan every year, hospitalized twice every 5 years, and have several other services. And the scenario where if they chose a plan wise, you could save $10,000 over 5 years on an Advantage plan. And I can see why a lot of people want to do that, but you gotta know those risks, and that's what we're going to do. When you come sit down with myself or any other agents.
It's the Health Insurance Store on your local station, WMBS, with Aaron Zolbrod. Again, we've got about 12 minutes. There's still time to take your call at 724-438-4593, 724-438-4593. And when we talk about total cost of ownership, and you've touched on this, but I would like to restate that you can't think of this on an annual basis. You do have to look at it long term as well.
You have to look at it, short and long term. So when I meet people, I've had people say, well, why would you talk about something so awful as getting cancer? I have to tell you, I know nobody wants to talk about what would happen if you got cancer. What happens if you are diagnosed with Crohn's disease or rheumatoid arthritis and you need to get that Remicade infusion that costs $4,800 every year. That's your copay if you have an Advantage plan. I have to talk about that scenario where you had a stroke and needed 45 days in a skilled nursing facility. I have to make sure you understand what's going to happen not only in the best case scenario, but in the worst case scenario. They have to understand that. There's short term, and again, you asked, is everybody best with a supplement? The answer is no. Right. We have been far more active in calling our people that are starting to pay $250 and $300 a month for a supplement, because when you're doing that and spending $3,600 a year for a supplement before you've paid your Part B deductible of $200 and possibly your Part D deductible of $400, the value of those are going down. And again, every single person is different. There's so many factors, and we definitely invite anybody who doesn't get who hasn't sat with us before or talked with us before. We invite you to at least just give us a call, tell us your scenario. Most of the time, we can just tell people, "Oh no, you're fine where you're at," or you might say, "No, you need to really come in." And then we invite our clients who have been with us for 10 or 12 years, who are getting into their late 70s, early 80s, invite you to come back in and sit down with us, and let's go over this again. Let's make sure you are getting the best value in plan. It might be time for us to switch you from supplement to Advantage plans and explain to you the risk that you're taking to do that and the rewards. And that's really what it comes down to, Bill, is everybody has to know the risk versus the rewards of supplements and Advantage plans.
724-438-4593, and we have a phone call, Aaron. And hi, you're on with Aaron Zolbrod. Who are we speaking with here?
Aaron?
Yes.
Is that you?
Hey, CJ, I almost forgot. I couldn't believe you didn't call. I was like thinking we haven't got a call today, and I didn't even think about you. Thank God you didn't.
I was listening to you rapping. Everything sounds good.
Yeah,
you're right on the job.
Thank you, buddy.
I'll hire you forever.
Well, thank you, CJ. I mean, you're a great, again, you always call in the perfect timing. You're a great example of somebody who's really, really done well with an Advantage plan.
Oh, I've been down the road.
That you probably, I don't know how long you've had it for years and years and years, and you haven't had that many out-of-pocket expenses, have you?
No.
So, I mean,
no.
Especially
I had that since you started.
And do you mind me telling everybody how old you are?
Well, go ahead, tell them.
I mean, I know you're in your 80s.
Yeah.
And, if you had taken a supplement when I met you...
86. I'll be 87 pretty soon.
If you'd have taken a supplement when I met you, you'd have probably spent $15,000, in premiums over that time.
Oh,
and
yeah.
My guess, and over the time we've met you, you spent not a dime in premiums.
Oh, you took care of the missus, too.
And I'm guessing that over those period of times, let's say on the high end, that's guessing between you and the missus, you had $5,000 worth of copays. Well, we still saved $10,000 in premium.
Oh, yeah.
So you're an example of who an Advantage plan has worked well for.
Very well. Very well.
20 of you, there may be for every 20 of you, there may be somebody who spent $20,000 in premiums over that same, or $20,000 to $25,000 in copays over that same period of time.
That's right.
And it just goes to show you that there is no one size fits all. I don't know how you do it, CJ, but you always, even when you don't have a question, you always seem to call at the perfect time, my friend.
Well, I've become friends with you for years now, and I just enjoy saying hello to you.
Well, thank you, CJ. We appreciate you being a client for all that time.
And I even enjoyed saying hello to Willie Billy.
There we go.
Yeah, isn't that Sam the Sham and the Pharaohs? Anyway.
I have to get Billy in there. I watch him on that there computer there. Boy, he's looking good. Well, he finally got a haircut.
Finally, yeah. Well, after they let us out.
Anyway. Okay, guys. Go
okay,
ahead
CJ, take care of yourself.
Have a great day, great weekend. God bless you.
Thanks, CJ. CJ joining us there. It's the health insurance store with Aaron Zolbrod. And if you would like to call him at the office, it's 724-603-3403 or online at getyourbestplan.com. And in our last 5 minutes or so, Aaron, we have been talking about 3 questions that basically spurred your most recent columns. And let's recap what needs to be considered if you're thinking about changing your plans.
Well, I mean, It's hard to tell people, but if you're going to try to do it on your own, you got to know what benefits are changing from year to year. And the beauty of supplements is your benefits never change. Your premiums are going to go up, but the benefits never change. We're not going to have any more out of pocket from 1 year from the next. Where with Advantage plans, you have to know when copays are going up for things like, especially for things like hospitalizations, or when benefits are like comprehensive dental or over the counter are going to be eliminated, and that happens a lot. You've got to make sure that you're always on the best possible plan, and doing that on your own, if you're not a client of ours, is almost impossible, because you're going to get a 150-page book, and hidden inside that book is going to be what those are going to be. If you're a client of ours, we're going to tell you what those are every year. We're going to make sure you understand that and keep you in the loop. I will tell people that if you're not a client of ours and you want to be put on our database and tell us what plan that you have, we will send you the same recommendation letter we send our own clients. I think the best way to do it is just make a phone call to us. You don't have to wait until annual election period, which starts on October 15th. You can call us now and say, hey, I've got XYZ plan, and we'll tell you, listen, at this time that plan's not competitive. We think you're overpaying in premium, or we think your copays are too much. Call us back or let us put you in our database, and we'll tell you maybe that plan will change to where it is competitive in next year. But, plans who generally aren't competitive normally aren't competitive year after year, so you're going to be prepared to come in and make an appointment and sit down and let us make sure you're on the most competitive plan that there is. And that's the beauty, again, about dealing with a broker. We don't care what plan that you're on, because we're going to be compensated either way. We just want to make sure you are on the plan that offers the best value. That's the reason why we have over 10,000 clients, is because we take care of them. If we didn't do that, we're not going to get referrals from clients over and over and over again. It's why we're so busy, is because we're taking care of, to the best of our ability, each and every client, and trying to make sure they're on the best plan every single year.
And again, we've brought up a topic that we've probably talked about without giving it a name: total cost of ownership. And again, this is something where you can sit down with somebody and run the numbers for them and show them what the total cost of ownership is going to be.
That's correct. We will show them. We'll put pen. Let us show you. Let's put pen to paper. Let's show you where you're going to save money, where you could be, where it might cost you money. Let's put it to paper. Let's do the math together. That's what we're going to help you do. We're going to help you do the math. We're going to help put together scenarios where this is where you can benefit, this is where you're not going to benefit. And then again, you sit back and take that all in and say, what is my aversion to those risks? One of the nice things about supplements is they may be more expensive overall, but the thing about supplements is we know what we're going to pay every single year. Nothing can come up and surprise us. The beauty of Advantage plans is I have the potential to, I just showed you a situation where several people over a 5-year period can save $10,000. Which is more comfortable? Let's put those scenarios, let's lay them out in front of you, and let me help you decide, what you're most comfortable with.
And again, something that we addressed early, but if you're thinking about whether you should keep an Advantage plan or a supplement plan, that's an excellent time to give Aaron a call and let him sit down with you.
Yes, anytime. Anytime is fine. There are people that can change now, and even if you can't, this is a good time to visit with us. We're not busy. You can get an idea before open enrollment, and again, we don't charge anything.
That's right. So you sit down, talk, you get information, and what Aaron also does is he doesn't say, this is what you have to have. He lets you make the decision.
That's right. That's correct. We're here to guide you. That's all.
Right. And good guidance it is. Again, if you want to talk to Aaron at the health insurance store, 724-603-3403, or online at getyourbestplan.com. Plus, you've got the Facebook page up and running, and you've got archives as well.
That's correct. You can go to the website and find our columns, find our webcasts, podcasts, and listen to all that stuff if you'd like to get some more information.
And again, they're all archived there, all the webcasts and podcasts. And again, your column, which, by the way, we'll make sure it's Ask the Medicare Specialist, appears when?
Fridays on page A2 of the Post-Gazette, and Tuesdays on A7 in the Trib. And
with that, Aaron, that wraps up the 2 hours, and it's been very informative. I'm glad we got together, and we'll look forward to doing this again in a couple of weeks.
Thank you.
Thank you. Aaron Zolbrod and the Health Insurance Store here on your local station. Again, 724-603-3403 or getyourbestplan.com. Your local station, W266DB, WMBS, Uniontown. It's 3 o'clock.